Hi, my name's Debbie and I'm a clinical nurse specialist at Salts Healthcare. I wanted to talk to you about the difference between flat wafers and convex wafers. Some people call them a base plate or a flange, and when your stoma nurse might recommend one or the other. This is what a flat wafer looks like, and this is what a convex wafer looks like. The reason we have a variety of wafer options is to ensure a good fitting bag and therefore prevention of leaks and skin irritation. As a general rule, when it comes to ileostomies and urostomies, if you have a well-spouted stoma on a relatively flat abdomen, then flat wafers are suitable. When it comes to colostomies, if your stoma is on a relatively flat surface, so not sitting in a crease, then a bag with a flat wafer is usually recommended. It's necessary for a specialist stoma care nurse to assess their patient thoroughly before using a convex product. We generally use convexity for stomas that are not well spouted to encourage the output to flow well into the bag. And this is also the case if a stoma is in a crease or sitting within a moat or a dip. We can also use convexity in an attempt to minimise pancaking. The convex shape ensures there's always some air in the bag, which can encourage the stool to drop down into the bag. And convexity encourages protrusion of the stoma, so the contents can fall into the bag more easily. There are varying degrees of convexity, and it's necessary for the specialist stoma care nurse to assess their patient thoroughly before using a convex product. In most cases, the stoma nurse would recommend that you try a soft convex wafer with a shallow depth as a first port of call to avoid any pain or discomfort. A good example of a soft convex wafer is the Confidence B Go. Remember, you must always consult your stoma nurse if you would like to try a new product or simply would like more information.